Good afternoon. My name is Dr. John George. I serve as the Executive Director for the Pennsylvania Association of Intermediate Units, also known as PAIU. PAIU represents the 29 intermediate units across the Commonwealth of Pennsylvania. And on behalf of all the intermediate units and the Pennsylvania Department of Education and the Pennsylvania Department of Health and Ginkgo Bioworks, I am pleased to welcome you and thank you for taking the time this afternoon to be with us at this very important press conference. Here with me today is the Pennsylvania Association of Intermediate Units President, Dr. Mark Hoffman, who also serves as Executive Director of the Bucks County Intermediate Unit. Also, Dr. Andrea Saya is the Executive Director of the Capital Area Intermediate Unit, and she is hosting this press conference here today in her building, IU15. Thank you, Dr. Saya, for your hospitality. We are very honored to welcome the Pennsylvania Department of Health Acting Secretary, Dr. Allison Beam, the Pennsylvania Department of Education Secretary, Noe Ortega, and Dr. Karen Hogan, the Pennsylvania General Manager of Ginkgo Bioworks. And joining us virtually this afternoon will be the U.S. Department of Education Secretary, Dr. Miguel Cardona. Now it is my honor to introduce to you Dr. Allison Beam, Acting Secretary of the Pennsylvania Department of Health.
Good afternoon. My name is Allison Beam, and I'm Pennsylvania's Acting Secretary of Health. Thank you, John and the Intermediate Unit, for hosting today's very important announcement. I'm also honored to be joined by my colleague, Secretary of Education, Dr. Noe Ortega, Dr. Karen Hogan from Ginkgo Bioworks, and U.S. Department of Education Secretary Miguel Cardona, who will be joining us virtually. The Departments of Health and Education are focused on getting students back into schools safely and on the field. Meanwhile, we continue to see predominantly unvaccinated Pennsylvanians infected with multiple variants of COVID-19, including the highly transmissible Delta variant. That's why we are here today to announce two major initiatives to help K-12 schools and universities maintain in-person instruction, sports programs, and other extracurricular activities for students. We know that the COVID-19 vaccination provides the best protection against the virus. That's why I signed an order directing vaccine providers to coordinate vaccine clinics with K-12 schools and institutions of higher education. When requested to do so by a school, vaccine providers are expected to make every effort to coordinate a vaccine clinic for the employees, the contractors, volunteers, students, and students' families within a school. We know that this is happening already across the state. Governor Wolf and Secretary Ortega have already visited several schools performing vaccination clinics. I want to thank these vaccine providers who have already partnered with schools to provide the COVID-19 vaccine. We want to encourage others to do the same, though. We understand that not every vaccine provider is going to have the capacity to staff an on-site clinic. If a provider is unable to coordinate a clinic, the provider is responsible for directing that school to the Department of Health and will help coordinate that vaccine clinic with another provider. The key is to get as many Pennsylvanians vaccinated so that we can stop the spread of COVID-19 and the Delta variant. Safe and effective vaccines are our best protection available. Because adolescents under age 12 still cannot be vaccinated to protect themselves against the virus, and because the Delta variant is spreading so rapidly, we need all of the people surrounding them to get vaccinated. To supplement vaccinations, we're introducing a no-cost voluntary testing program for all K-12 schools outside of Philadelphia County because they receive separate funding to enable voluntary COVID-19 testing to help keep kids in classrooms and COVID out. This testing program will be operated through Concentric by Ginkgo Bioworks, better known as Ginkgo. They have developed a program ideal for Pennsylvania because it's designed to support local flexibility for testing plans that meet both local needs and the Centers for Disease Control and Prevention guidance. Ginkgo's program starts with a foundation of pooled testing, which combines nasal swab samples from a classroom or group and runs them as a single test to determine the presence of COVID-19. Across the country, this methodology has been used in schools as a simple and scalable way to easily test many people at once, while minimizing resource strain on classroom teachers or school administrators. A typical classroom test can be administered in about 10 minutes. When schools opt in, Ginkgo provides all the training and testing materials necessary, as well as staffing, lab, and data processing services. Before selecting Ginkgo, we contacted states who are already using them. We heard nothing but positive feedback. Students, teachers, nurses, school administrators alike have described the testing process as simple and painless. The program alerts schools quickly if COVID-19 is present within the classroom or the school environment. Early detection like this is exactly what we need to keep students in classrooms and COVID out. Supported by the Department of Health, Ginkgo's comprehensive program also provides schools with staffing support and individual molecular or rapid testing on site at each location. Dr. Karen Hogan is with us today from Ginkgo to answer questions you may have about the program. This testing initiative, in conjunctions with vaccination and masking, is the best thing schools can do to keep Friday night lights shining brightly this year. It's clear that everyone wants to keep kids in the classroom and keep extracurricular activities going. That's why we're encouraging all K-12 schools to take advantage of this unique opportunity to bring COVID-19 testing into schools at no expense to the school. In addition to the pooled testing process, Ginkgo makes it easy and convenient for students, faculty, and staff who feel they need or want a test to have access to free COVID-19 testing. These two new initiatives are our latest efforts to keep kids in school and COVID out. We're working closely with the Department of Education and Ginkgo to provide an abundance of information to help schools make informed decisions and take advantage of this testing opportunity now. We are continuing that education process with school leaders today, and we appreciate the intermediate unit's support. Now, I'd like to introduce Secretary of Education, Dr. Noe Ortega.
Thank you, Acting Secretary Beam, and good afternoon to everyone. Thank you, Dr. George, to the folks at the Capital Area Intermediate Unit who allowed us to come here as well. I am honored to stand alongside my colleagues and community partners today to reiterate the importance of the free COVID-19 testing initiative and the COVID-19 vaccine clinics at higher education institutions and K-12 school entities throughout PA. As communities across the Commonwealth prepare for a new school year, we must continue to work together to maintain healthy and safe conditions for our students, our teachers, and our school staff now and into the future as required. In fact, the continued provision of face-to-face learning is dependent on our ability to be able to do so, to engage in the recommendations and opportunities that are being put forth by our partners at Ginkgo, the Department of Health, and the Department of Education as well, to ensure safe learning environments for all those individuals I named before. Educators and the Department of Education know that students learn best in their classrooms. We also know that schools are a great place for our students and the families to get the COVID-19 vaccine. A recently released poll by the Kaiser Family Foundation said, in part, that parents were twice as likely to get their children vaccinated when schools reached out and provided them with the necessary information to make that informed decision. So as we continue to fight this pandemic and protect in-person learning for the children of the Commonwealth, initiatives such as the ones that we're here to announce today with the COVID-19 clinics are vital to our success. We are proud of the colleges, universities, schools, and school districts across Pennsylvania that mobilized and created pathways for their communities to the COVID-19 vaccine this summer. Let's keep that momentum going to help protect and maintain healthy conditions in all our schools. I encourage all our schools to coordinate COVID-19 vaccination clinics for their communities as soon as possible. And I encourage all K-12 schools to participate in testing programs as well, which will help support mitigate the spread of the COVID-19 and outbreaks in the school year as well, to keep us in the classroom so we can ensure that students learn. Thank you, Acting Secretary Beam, the Pennsylvania Department of Health, for creating this opportunity, in collaboration with the Ginkgo Bioworks team as well, which will provide a menu of COVID-19 testing services and supports at no cost to our schools. I know our school communities go to great length to serve and support Pennsylvania students who are our future. And for that, I thank them. And I thank you, the people of Pennsylvania, for doing your part to help keep our students in their classrooms and our school communities safe. We know students and teachers across the Commonwealth are really looking forward to returning to their classrooms. So let's do everything we can to make sure they're safe while they're teaching, learning, and growing together. It's now my honor to invite my colleague, Dr. John George, back to the podium, the Executive Director of the Pennsylvania Association for Intermediate Units, to provide a few more remarks to the group. Dr. George.
Thank you, Secretary Ortega. So the 21-22 school year is upon us, and the focus right now of every school and every intermediate unit is to provide a safe and supportive learning environment for students. To accomplish this in the midst of a global pandemic, we must strive to ensure that every school is equipped with multiple mitigation strategies so students can reap the benefits of in-person instruction and extracurricular activities. We know that having children and youth back in schools and having access to in-person human interaction is vital to their social and emotional wellness. This is why the Pennsylvania Association of Intermediate Units are honored to partner with the Pennsylvania Department of Health, the Pennsylvania Department of Education, and Ginkgo Bioworks to assist schools implement mitigation strategies in order to maximize in-person learning opportunities. This year, the Pennsylvania Intermediate Units are celebrating 50 years of service, 50 years of providing educational services and supports to public and to private schools. Intermediate units have long partnered with the Pennsylvania Department of Education to deliver technical assistance and professional development to schools and to deliver instruction, both in person and virtual, to improve the educational outcomes of children. Just a few months ago, Pennsylvania's intermediate units, for the very first time, partnered with the Pennsylvania Department of Health and played an important role in providing vaccinations to approximately 110,000 educators in Pennsylvania. We know that vaccinations are an important weapon in the fight against COVID, and we need to continue to educate the public about vaccinations, and we need to ensure that vaccinations are readily available to those who choose to be vaccinated. While vaccinations play a critical role, access to testing is also an important strategy in the fight against COVID. And just as we have supported vaccinations, Pennsylvania intermediate units stand ready to support those schools that choose to implement a testing program. And once again, intermediate units will be available to assist schools with many other COVID-related matters. So on behalf of all the Pennsylvania intermediate units, I would like to extend our sincerest appreciation to Governor Tom Wolf, Acting Secretary Allison Beam, Secretary Noe Ortega, for providing the educational and health-related resources necessary for schools so students can learn in a safe and supportive learning environment. In addition to our partnership with the Pennsylvania Department of Education and the Pennsylvania Department of Health, we now look forward to our new partnership with Ginkgo Bioworks. And it is my pleasure to introduce to you Dr. Karen Hogan, the Pennsylvania General Manager for Ginkgo Bioworks. Dr. Hogan.
Hello, everybody. It's a real privilege to be here alongside these leaders in education and public health. I'm grateful to them and I'm proud to be here representing a team from PA and from across the country at Concentric by Ginkgo. My name is Dr. Hogan, and I'm a lifelong PA resident. I was also trained as a scientist at the University of Pennsylvania. And today I'm here as both a scientist and a mother, and want to tell you why this program matters to me. My children are school-aged, they're 5th and 7th grade, in Pennsylvania public schools. My youngest son, Declan, is in 5th grade and is unvaccinated. And that's simply because he's under 12. He doesn't have access yet to this vaccine. My 7th grader, happily, is one vaccination down. But Seamus has pretty severe asthma. So like many households in the state, we've been high anxiety on how to protect him during this pandemic. Both of them have been largely out of school since March 13th, with a little bit of time back in the classroom this past year. As a parent, I can tell you firsthand what a toll that took on them, both on their physical and social health, but also remarkably on their mental health. Parents across the Commonwealth have to strike a really, really tough balance. On the one hand, we want our kids in the classroom, but we want them safe. It's really important that we make decisions that are based on data that can help protect their health. Put simply, testing in schools helps us make those decisions. Testing helps us interrupt transmission cycles as early as possible. It gives us information on how other measures are working within the classroom. Mostly, it gives me peace of mind that our school communities are doing all they can to make sure that in-classroom learning is the safest place to be. Our program's foundation, as mentioned before, is pooled or cohort testing. It's really, really simple. We test kids as a group. It's a lot easier and more efficient than people are used to. There's none of this deep, tickling brain nasal swab. Instead, it's a nice, shallow swab. In fact, many of our students say it's the first time they're allowed to pick their nose. We support everything from staffing to follow-up testing. We understand the operational lift that's present for school communities to implement a testing program like this, so we've taken that into account to make it as easy as possible. It's a simple process. It's built and it's running across the U.S., from Arizona to North Carolina, New Hampshire to Maine. Our team partners with state-of-the-art labs, several of which are here in the Commonwealth. And our systems are built with privacy as a core design principle. Your experience and data security is a pillar of our program, not an afterthought. Nothing about this time is easy, but I'm grateful as a scientist and a mother to come together, whether we're in education or in public health, to support students in our community this fall. Please let your schools know about this important program and make sure you sign up when it's time. Thank you, and we're always here to answer any questions.
Thank you, Dr. Hogan, and it's always great to have somebody who is both an alum of this great institutions of Pennsylvania, but also a concerned parent return to partner with us to help ensure that schools are safe. It's now my honor to introduce our guest who's being Skyped in or Zoom in from his place in D.C. to provide some remarks today. So Dr. Miguel Cardona, who's the U.S. Secretary of Education, will be joining us to provide a few remarks. Dr. Cardona, please.
Thank you very much. And thank you, Governor Wolf, Health Secretary Beam, and Education Secretary Ortega for your leadership in implementing this important program to allow our students to get vaccinated and to have screening done to make sure we know how to keep COVID-19 from spreading. You know, you've heard a lot about challenges that we're having, making sure that we're doing everything to keep our kids safe in school. And in some places, unfortunately, that's where we're spending energy. But let me tell you right now, I'm so proud to be able to join you today to lift up what we want to see across the country. Pennsylvania, you're leading the pack. You're leading the pack in intentional collaboration and ensuring that we can do everything in our power to safely reopen schools, provide those not only those mitigation strategies that we know work, but provide testing and vaccination, because we know that if we can vaccinate those who are 12 and older as soon as possible, it's more likely that students will be able to have in-person learning uninterrupted. It's more likely that students could get engaged with those extracurricular activities that they've been missing in many cases for over a year and a half. It's more likely that our students could get back on the field and play sports and just engage as students. I too am a father, and I appreciate Dr. Hogan's mention of her own children. Listen, we're all in this together. We want the best for our children across the country, and we have a responsibility to do everything in our power to give them the best chance at success. And what I'm seeing in Pennsylvania is an example of what we could do when we put our minds together, when we remove the politics from it and say, how can we help our children? How can we help our schools? Thank you for the work you're doing on behalf of all the students in Pennsylvania. You're fortunate to have such an intentional collaboration happening in the state. And we know when that happens, it works. Listen, the president put a charge out there several weeks ago to all governors. Do what you can to try to get vaccines, pop-up vaccine clinics set up in your schools. Do what you can. I had conversations with governors from various states, both red and blue states. And I think we all agree that vaccinations help, and we have to do more to get vaccinations in the arms of those who are eligible. But Pennsylvania took it to another level. Governor Wolf and his team took it to another level. And I just want to say thank you. I want to say thank you because I'm hoping other states are watching what you're doing. And if we can have the same level of commitment, collaboration, proactive, solution-oriented strategies, I know across the country we can defeat this virus quicker. And you're showing that it can be done in Pennsylvania. Thank you. You not only responded to the president's call to action, but you're leading the charge. So keep up the great work. And I know once we get our schools open, the goal is not to get back to where we were in March 2020. It's to build back better. So thank you, Pennsylvania, for what you're doing, the collaboration that you have there. The students and the families are fortunate. And that's why when I heard about this, I said, I have to say thank you. I have to say thank you publicly for doing what you're doing. You're leading the pack. Keep up the great work. And I hope you have an awesome school year ahead. Thank you.
Thank you so much. To everyone who was able to speak today, we're happy to answer questions now that folks may have. Go ahead.
Can someone tell us what the testing in the classroom will look like, including will the group testing, would it take place in a classroom or would they be taken to the auditorium, and what would trigger it, and would say families have to opt in or out, or would there have to be permission
Consent.
slips?
Yeah, absolutely. I'm actually going to turn it over to Dr. Hogan, given that she has the expertise from Ginkgo.
Thank you. That's a great question. We've been working with schools, over 1,000 schools, including all of last school year, and we help schools design what works for them. For the most part, we see that in-classroom testing is the easiest way to do it. So maybe once a week, it could be Wednesday morning. Students are sitting in their classroom. They pull down their masks. They do a simple 4-second swab in one nostril, another 4 seconds in the other, and then that goes into a single tube that's capped and sent to the lab. We have support staff that can arrive so that teachers don't have to implement that program. The support staff that arrive, who are healthcare professionals, oversee that. Everything is optional. Parents definitely need to consent in for their children, and we have a lot of experience helping with that. We actually provide our consents in, I think, 27 languages to really meet families where they are.
It sounds like some of the students actually do the swabbing themselves.
Yes, it's mostly a self-administered swab. We have had students as young as kindergarten self-swab, but we do provide support staff to oversee that, or if we have students with special needs, that's definitely somewhere that we can assist with the collection.
And one more thing I'd like to ask, in the past, especially early on, there was big delays in testing, and it was a huge problem in getting test results. like what can you guarantee about the timing of receiving results?
That's also a wonderful question. My first job when I started at Concentric was to help build up our national lab network. We know that by having local labs that are close to the schools, we can ensure sufficient and rapid turnaround times, and we actually contractually obligate our labs to meet those turnaround times. So that is another core pillar of the school design. That information needs to get back to the schools as fast as possible.
What is the, I mean, what can we count on in terms of, like, we talking the same day, or are we talking like up to 12, within 12 days?
Oh, no, not within 12 days. Within 24 to 48 hours of sample collection. Most programs are testing once a week, though there's flexibility for schools to decide the testing frequency. It becomes really routine for the school, and it's regular reporting.
Thank you.
Should I step back?
Sure, we can actually test and see what the next question is. You might stay up there, but sure. Do you want to go ahead?
I have two questions, so I hope you'll bear with me here. Number one, when the vaccines first rolled out, early childhood providers were included in the plans. What is your plan for them as far as this testing? Are they included in that? And if not, what kind of guidance are you giving them?
Sure. So let's start with pediatrics and primary care physicians have been in our network from the very beginning. We were able to actually have, at this point, supply is not a problem of vaccine. And so right now, really our network is inclusive of any provider who wants to be in the network, right? And so when we saw the adolescent vaccination rollout happening over the summer of even anyone under 18, we really did that proactive outreach and said, get registered here in Pennsylvania so that you can actually be a vaccine provider, order, have it delivered, and the like. That's only ramping up as we're seeing the lower and lower ages approved to get vaccinated. That is happening somewhat separately. We think that there's a lot of families that want to get their child vaccinated when they're going for their routine appointment or the like. Having this testing in the school setting is going to bolster the ability to have people educated on COVID-19, but vaccinations, we're going to be able to actually have what would be more akin to mass vaccination sites or larger vaccine clinics happening in the school if, frankly, a parent wants to go and just have their child vaccinated more quickly. And so pediatricians and PCPs are still a valued member of our network, but ultimately the schools are likely going to partner with the provider that they see most willing to have the capabilities to deliver something in the vaccine clinic in their school.
So they're not going to have access to this testing then?
So the school testing is separate from our vaccine network. I just want to separate out the two networks.
Do they also have the ability to opt into this testing, or no? Or are they left out of that testing? And it's only for districts?
So the schools can opt into the testing, but PCPs and pediatricians are still able to offer COVID-19 testing to any of their patients or their patients' families to the extent that they see fit.
Okay, just not through this program then?
Correct.
That's what I was wondering. My second question for you is having to do with the testing itself, and you may not know the answer. I'm sorry. I should have
Hogan?
asked the second question first. Can you tell me what the average cost of one test for a classroom would cost? I know it's free to the schools, but somebody is paying for it, and where that money's coming from. And also, number two, when you say a pool, how many students are needed to get an accurate result?
So I'll start high level with the financials and then be able to go into, I'll defer to Dr. Hogan on the expertise for the per test. So for Pennsylvania, we were actually granted federal stimulus dollars to set up exactly this program. And so we are spending $87 million through this procurement to be able to bring Ginkgo in and provide this throughout the school year, commonwealth-wide. And so for us, it is it's a part of our epidemiology and lab capacity grant that the Department of Health is getting, and that's where the funding's coming from for the Ginkgo contract.
And I'll just repeat myself so you don't forget. What is the average cost of one of these tests, just one of them, and how many students do you need to have an accurate test?
So the average cost is $5 to $6 per student. A key design principle was making sure that it was affordable across the board for all communities, school communities. We allow anywhere between 5 to 25 students in a single pool.
Just to be clear, the idea of the pooled testing is, I take it you're not reporting back individual results for students.
Correct.
Yeah, so you're not going to notify a student of their status.
Correct.
But what is it that you what is it that you get then? I mean, is it a percentage? Like, what is the answer that you're seeking in the pool testing?
This is a great question. So the exception, not the rule, is to have a positive pool. Most of the school community is very safe, and that's why we want kids back in the classroom, but we want this data transparency. When there is a positive pool, the schools follow their local public health authorities on the follow-up testing. So they could conduct rapid antigen tests or individual PCR tests to identify who that person is, but that would flow into a diagnostic workflow with all of the protections around it.
So would it just be a matter of like, okay, we have one positive case out of this group of 20, or, you know, we have a 50% positive rate?
That's what the follow-up testing would be on the positive pool. So at that point, when a pool comes back positive, you're able to engage the individual diagnostic workflow to identify whom within that pool, and that could be one student or multiple students that are positive.
So are you testing, you're just going into a classroom and testing everybody or everybody whose parents agree, whether they're symptomatic or not?
Correct. So it's any student whose parents have consented to the process. That's a key point to the program. And regular weekly testing helps the school community very quickly identify when a positive pool does arise so that quick intervention can take place to help break that transmission cycle.
Is there a certain threshold of participation you need for this to be worth it?
We've seen school communities as high as 80 to 90%, and some that exist at 20 to 30%. And so we've seen a range of participation rates, and it's been very effective at helping keep the pooled prevalence down.
Dr. Hogan, I'm happy to see if there's other questions too. Yeah.
For you, Secretary.
Okay, great. Thanks. Yeah, for sure.
So our understanding is this, both the vaccine clinic initiative and this new testing program is voluntary for schools now.
Absolutely.
But how does this help students and parents who are living in areas of the state where schools and districts are less likely to participate in these treatments?
So part of this is also educating the general public on what's available to their school district. This is similar to what we've been able to advocate for at a localized level. Parents are going to be some of the strongest advocate for putting these protections in place, right? And so letting them know that this testing availability, this testing capability is out there for their districts to voluntarily opt into. We'd like them to speak with their school leadership and encourage them to really seize this opportunity. Likewise, on the vaccination order, there they can really work with their school leadership to encourage them to actually hold a vaccination clinic. And if the local provider isn't able to do it, again, the Department of Health will help step in and partner them with a provider that can. Sure.
Just looking ahead to the future a little bit, but I know teachers were among the first to get vaccinated, and at this point, we're looking at doing a third dose now for those who are immunocompromised. So is that something that's on your radar that could be happening with the intermediate units again in the coming months, a third dose for educators?
Sure. And so Dr. George and the intermediate units have been unbelievable partners throughout getting our initial tranche of educators vaccinated. So for additional dose planning, we have really engaged in scenario planning of what may come at all different times. And of course, part of that is if there's immunocompromised individuals that could actually be embodied in some of the teachers that we vaccinated, or if there's ultimately, I think there's going to be different populations that the federal government highlights for those additional doses. To the extent that that would be helpful, if there's some sort of additional dose required for the Janssen product, we would be happy to have the intermediate units, again, be strong partners in that. And hopefully, again, we are in a different landscape with vaccinations, right? Supply is not as constrained, but if necessary, I think that infrastructure was successful the first time, and if anything, lessons learned, or that we take best practices and try and do them all over again. Yeah.
Two questions, just to follow up with her question. Have vaccination rates been shared, or will they be shared regarding school staff and teachers, things like that?
Sure. So we have county vaccination rates that we've been able to share at a lower level. We hit against some of our confidentiality laws. And so at this stage, what we've been able to share as the Department of Health is the county level vaccination rate.
Okay. And then, so last week we heard from Deputy Secretary Kleinpeter about the state mandate for nursing homes and hitting that vaccination goal.
Yeah.
This seems like a very different approach. Can you talk a little bit about the approach that nursing homes are taking with the mandating the rule versus with schools where, this initiative is a little different?
Sure. So one of the interesting things that we have been able to put more data out about, because the federal government has collected it, is our staffing and resident vaccination rate in long-term care facilities. That data really was able to indicate to us that we have serious areas of concern within our long-term care facilities, particularly where there are extraordinarily low staffing vaccination rates. And so for us, part of that announcement was making sure that folks know that they can come to the Department of Health, and we now have on a dashboard by facility the level of vaccination rate for staff and residents. Again, we want to have families advocate to these long-term care facility staff the importance of vaccinations as much as we are. But nonetheless, we also wanted to collectively set a goal. Our skilled nursing facilities particularly are areas where we want to drive them to encourage their staff, whatever it takes to educate, communicate, really understand the need for vaccinations moving forward. And so our goal setting on getting our skilled nursing facilities vaccinated was really contingent on that data, and we want to continue to work with our skilled nursing facilities. As Executive Deputy Secretary Klein-Peter had stated, if not, there will be testing requirements then that will have to come in to, again, try and protect those vulnerable residents. Please.
Can you talk about the timeline for the vaccination clinics and how that's going to work? Because you mentioned you want parents to advocate. So whose decision is it? School board superintendent, and how quickly will this work through? How do school districts learn about this? And how soon do you see these vaccine clinics set up?
Sure. I'll start, and then Secretary Ortega, if you want to add in at all. So as I stated, the vaccination supply right now is ample. And so these vaccination clinics can start as soon as possible. What we want to make sure our provider community knows is that if they're approached by either a K-12 school or an institution of higher education, that our expectation is that they really do try and service that need of getting a vaccination clinic running. However, the department stands at the ready to really do that partnership where the provider isn't able to staff up. And so that is, I believe, the order is already effective, and so that can start as soon as possible.
And to the second part of that question, I just want to remind us that the philosophy or the approach that the department has taken with the Department of Health throughout the entire pandemic is that this is a school-level choice, and it's deliberated through whatever process they put in place. And so school leaders will at times work with the intermediate units and in terms of information, or will work with their school boards to make that decision. It has to be something that the schools at the LEAs opt into and then move forward in whatever process they put in place.
So if the community would be disappointed that their local school district would not want to opt in, is there an option or an alternative for those communities?
At the moment, I'm not sure if there is an option for the communities, Secretary Beam, in this plan. I think at the moment we focus the initiative on specifically the schools and the schools opting into partnerships. I don't know if there is, particularly with the Ginkgo partnership, something that's set up at the community level, but I'm happy to invite Acting Secretary Beam to see if there's any other options.
Sure.
If there is.
Yeah, sure. So I'm happy to speak. I just want to make sure in abundance of clarity. And so for the vaccination effort, so if there's a community that wants to hold a mass vaccination clinic of sorts, and their school's not interested in actually being the facilitator of that, feel free to contact the Department of Health. We really are working on trying to get out to county fairs and any forum where we can reach folks that haven't yet be vaccinated. And so we're glad to work with folks to try and bring together a vaccination effort. Separately, the testing effort, where a school district has decided to not participate in the program. At this point, we don't have an alternative for parents that want to have their child participate in that level of testing. It goes back to being tested at your primary care physician or pediatrician. Please.
Can you just remind us, either of you, the policy as far as masking goes, the guidance for masking in schools at this point, and is there any opportunity that you're looking at to potentially change it?
Absolutely. And so the CDC, the federal CDC, has issued guidance that recommends universal masking in K through 12 schools. And so this is regardless of vaccination status or high or substantial community transmission, that they have actually issued their guidance. And we, as the Departments of Health and the Departments of Education, are strongly encouraging school districts and school leadership to follow the CDC's guidance. I don't know if you want to. Okay.
I think that's good.
Okay, sure.
It's just a recommendation at this point. Any potential at looking at changing that depending on how things go?
At this stage, there is no discussion taking place as to whether or not there will be a statewide masking mandate. Yeah.
Last week, the head of the correctional union was frustrated at the mandate that you're putting on them as far as either get vaccinated or get tested frequently. And he said, and I've heard it said elsewhere, but I'd like to get your official word on it, that if we had the virus, there's quote-unquote natural immunity. Can you speak to, is there legitimacy to that or not? And he believes, because he says 40% of correctional officers that they know of have had the virus, they ought to be counted in as people who have been vaccinated as having this natural immunity. Can you speak to that, please?
Sure. So we've actually, so just to give folks background, that is as a governor's policy for our commonwealth employees that are in settings where healthcare is delivered. We are having a vaccination at this point requirement for them. Alternatively, folks will have a testing at a routine cadence. And included in that, given that there are individuals that access their health care through the corrections system, the corrections officers and the like will also be required to be vaccinated or tested. On that, the angle of, but I have immunity because I previously had COVID. Again, as a non-clinician, I'll speak a bit to it, but Dr. Johnson, our physician general, will be more articulate on it. What we've heard is that, yes, there is a natural immunity that comes with your body's response to having COVID-19. But as we work through these variants, right, your body not only has some ability to have that dissipate over time, but it might not be an immunity built to the current variant. And so, again, right now we are focusing on the Delta variant, given its significant prevalence in Pennsylvania, and folks who may have had COVID months ago may not have actually had that response to the Delta variant. And so it's more important that folks get vaccinated and add a layer of whatever protection is necessary to their natural immunity from getting COVID, but more than just relying upon that alone.
Doesn't the same be said, though, of people who got vaccinated before the Delta variant, which is many people, got vaccinated before the Delta variant came here, they also may not be protected against Delta variant.
So right now, three of the vaccines are showing incredible efficacy against the Delta variant. And so to be clear, what we want to make sure is that we retain that efficacy of the vaccines against whatever variant comes our way. And right now they are showing efficacy against the Delta variant. Oh, sure.
I have one more question for you, just as a side note. Our surrounding counties have been in high and substantial rates for some time now. Are you hearing anything from our local hospitals about hemorrhaging of patients or not having enough staff, the stuff we saw as of last year? Are they expressing any concern that they're not going to be able to keep up as cases continue to rise?
Sure. So I'll answer that question in two parts. So somewhat on our hospitalization rate, we've seen a significant increase. I think this morning's data is up over 1,000 patients hospitalized, which is an increase of over 100 individuals over the weekend. Again, part of it is looking at what our response is to that level of hospitalization, but also what it would be projecting for then the fall, when you are talking about folks moving indoors and schools coming back in session. The number one concern that we've heard from hospitals is, of course, with regard to staffing, and part of it is also fatigue, right? There's a frustration in staff when they were able to be the frontline responders previously. There was always somewhat of an energy that they were running off of, but now it's frustration because a vaccination is out there, and yet the hospitals are still filling up with folks. And so, again, our greatest focus then is on getting as many folks vaccinated as possible, not only to make sure folks don't end up being hospitalized, but also to make sure that that staff that has been heroes throughout our entire response, again, aren't fatigued and frustrated throughout the fall. Oh.
There's one more question?
A question from one of my colleagues that's not directly related to this, but asked me to ask about the availability of the third shot. He says he believes that the Department of Health gave the go-ahead for the shot to be administered. Can you give us an update on where that stands?
Sure. So Friday afternoon, we were able to get the federal green light for allowing our providers to move forward with administering an additional shot in those that are immunocompromised. So we were immediately able to contact our provider network, make sure that everyone was prepared by way of not only the staff resources, but also the supply of vaccine and the like. They're feeling very confident in their ability to meet this demand. But importantly, just to note, the limited circumstances in which the third or the additional shot was approved really should be first an encounter with your provider to determine if your immunocompromised individual should actually qualify for this. And so we are encouraging folks to first speak with a provider and then actually get that additional dose.
If I could just get your reaction to, I guess in today's news, we just released that we passed the 80% threshold of adults having at least one shot. Sounds like a big number, especially early on. They were saying they wanted 70%, and now we're at 80%. But yet, here we are saying we have to do all these other measures. What?
Oh, absolutely. And I think first measure is get the second shot, right? We have to be able to get folks fully vaccinated. One shot is only partial protection. And so our mission has shifted. Of course, we are focusing on that first dose, but my goodness, to protect us as well as we can coming into the fall, we want to now make sure that everyone understands that they should go get that second shot and go get it timely to allow us to be more protected heading into the fall. Sure. All right. Thank you guys very much. Appreciate it.